Dr. Stephanie Waggel here, and today I'm with ketamine expert Dr. Park, and he's going to answer some of the questions that you guys had. So, the first question, and very basic, is just what is ketamine?
So ketamine is a medication that we use at the hospital every single day. It's typically used as an anesthetic medication for the induction as well as the maintenance of anesthesia.
So our second question is what is ketamine used for?
So ketamine is, as I mentioned before, ketamine is primarily used as an anesthetic medication for the induction as well as the maintenance of anesthesia. It's also used to help patients with acute as well as chronic pain in the hospitals as well as in outpatient settings.
Okay. And so I think, especially with the Kowalski versus Johns Hopkins trial that I've been watching, there's some concern for, most of the questions were actually withdrawal, and this is where there was some discrepancy. Is there withdrawal? Have you seen any withdrawal symptoms?
So classically, chronic use of ketamine is not well, I would say, studied or as well as reported in the literature. There's probably some level of withdrawal that comes with daily or chronic consistent use of ketamine, just like realistically any other drug. But I can't say anything that has been consistently shown to been reported. You know, classically we think alcohol or opioid withdrawal to have classic features, but with ketamine withdrawal, it's still very much controversial or probably more unknown.
Right, so one doctor was adamant that there are no withdrawals, but my thinking is, honestly, if you abuse anything enough, you could induce withdrawals. I think he meant in the clinical setting, and that's where I think that the jury is a little bit confused, because another doctor actually came in and said that there can be withdrawals, and I think his response was to like street use and that sort of thing.
I think so. I haven't been watching it, but I think that first doctor means more. There's probably nothing specific, or probably more non-specific.
Right,
so
right.
Daily use of whatever medication, even Tylenol or ibuprofen for headaches, you can have a rebound headache or withdraw from it as well. And so with ketamine, I don't think there's anything specific. I mean, you might have like a general sense of maybe lassitude, maybe a headache, but feeling a little crummy, but I don't think there's anything specific to withdraw for ketamine, at least in my opinion.
Right, that makes sense. So, in case people don't know, withdrawal are the problems that you have when you stop medication or a drug. So let's switch up and talk about side effects, which are things that happen as a result of the use of the medication. Are there side effects to ketamine?
Yes, there are very well-reported side effects.
Those are not up in the air. We're not going to have a discrepancy about that.
Right. So the most common one that people will either read about and that we see clinically is probably that dissociation,
right,
or dysphoria with high dose or rapid administration of ketamine. Specifically, we're talking about like IV ketamine, which is the more common use with ketamine in the clinical setting. And so you definitely see that, as well as you could have some high blood pressure issues or increase in blood pressure with rapid administration. And nausea is probably a very common one as well.
Okay, right. Well, yes, I don't think there was any discrepancy on that. That's probably very well recorded. Now, there was not as much discrepancy in the answers here, but I feel like there were some mixed messages about addictive potential. Now, I'm thinking, I mean, really, you could get addicted to anything if you try hard enough. But I do have specific encounters working in the emergency room where people would come in from parties having used Special K. So is that addictive? Is it addictive on the streets versus in the clinic? Tell me what you see regarding addiction.
Yeah, so I think ketamine addiction, kind of like withdrawal, there's not a whole lot of consistently shown data or studies, at least none that I'm familiar with. specifically with ketamine addiction, I mean, like you mentioned, you can probably be addicted to pretty much anything. But ketamine is not, there is a general consistent effect of like that dysphoria and the dissociation that a lot of people don't find too pleasant. It's more neutral. I mean, there's some patients who have a pleasant experience and some patients who have a unpleasant experience, but there are probably better medications out there that cause more euphoria than ketamine.
So you're saying if somebody had to pick a drug to abuse, ketamine wouldn't be
no,
the best?
Yeah.
Not that we're saying anyone should pick a drug to abuse.
Yes, but ketamine is not a consistently, I think, abused medication. I'm not an addiction expert.
Right.
But there are probably other substances out there that people will find to have more euphoric effects.
Right. Okay, because when I have a patient that's refractory, I tried everything and I recommend ketamine, sometimes their only association with it is like Special K or something, and I kind of want to let them know that maybe let's not have that association with it anymore, because it does seem to be having a lot of really good and more mainstream, more widely acceptable uses. So why don't you talk a little bit about, for my sake, mental health ketamine, depression, those sorts of things?
Yeah, so we get those questions a lot. One of the main things that people ask about is it a horse tranquilizer? And it's used
isn't it?
It's used in veterinary medicine. But like I said before, it is used in the hospitals every single day for acute and chronic pain. There's also used in an outpatient setting for patients with significant chronic pain or neuropathic pain, or using high doses of medications to help with their pain. And then more recently, and I think just kind of more mainstream, like you mentioned, for patients with treatment-resistant mood disorders, depression, anxiety, PTSD. And so ketamine has, I think, a lot of applications in that realm. We're still, it's been around for quite some time in terms of that space, but I think in the last few years it's definitely caught a kind of a snowball effect, and that paradigm that mindset is shifting a little bit to being more accepted. Those are the uses that we currently use now. Who knows what it might kind of evolve in the future. I get also a lot of questions about psychedelic medications and things like that. Ketamine's not truly a psychedelic, it's more of a psychomimetic medication, or it has more psychomimetic effects. And so despite what people read online, it is a very safe medication as long as it's administered in a safe environment.
Right. I think that was a distinguishing feature that they need to really highlight in this trial, because a lot of the questions and responses were based on street use versus clinical use, and I think the jury was getting a little bit confused, so I think that they should put it in context.
Right.
Well, that's all the questions that I have from you guys. I'm personally going to stick around for some maybe out of the scope of our general audience viewing question. I'm going to surprise you with deeper questions off camera. So thank you everybody for your questions, and thank you, Dr. Park.
Yep, no problem.